All right, welcome back to another edition of Doc Talks. This week, we are talking about return to gym after injury. So, return to gym after injury is something that I feel like we like to specialize in here too. We definitely deal with people on the pain side, but we deal with a lot of people on the performance side or into the gym. So we definitely have that, we see that a lot. We see a lot of people go from the pain side to a more performance-driven reason for coming to Elevate.
Absolutely. Or sometimes people come to Elevate, they're feeling good, and then life gets in the way. Maybe you are playing tennis and something wild and crazy happened, or you dropped your sock on the ground and you had to bend over and pick it up and your back started hurting really bad, or you went hiking and you sprained your ankle. If any of those things happen to you, which I feel like are true stories here of people not only at Elevate but in life, this is definitely the Doc Talk that you want to listen to, because we will help guide you on how to bounce back as best as possible from that wild and crazy injury that you may have sustained, one, and also how to maintain your fitness levels so that transition is silky smooth.
I think that that point needs to be driven home, that life and the risk of injuries and pains, it's going to be around forever. Like there's no 100% guarantee that you're going to be pain-free with just regular day-to-day life. We got to make sure that that's not like the thought process of the people that we work with. It can't just be, oh, well, if I do this, I'm never going to get hurt. And then it happens. Life does happen, and I think some people are maybe in the wrong mindset. If they're doing everything right, then they can't get hurt. Sorry, like that's not how our bodies work. That's not how life works. We try our best to minimize risk with all the stuff that we do, warm-ups, cool-downs, techniques, wellness type care, things that'll help you stay as efficient as possible. But life is life.
Life is life indeed. Yeah, there's no such thing as injury prevention.
Yeah.
Because as we move around, something could just the series of events, the stars could be aligned in a manner that put you at risk at that given moment, and then something happens. So, just like in other aspects of life, you can't stop bad things from happening. Sometimes
you minimize risk, right?
That's all. Yeah.
Try to minimize risk as much as you possibly can. You wouldn't buy a crazy stock if you needed it to perform right now. Like it'd be a little bit higher of a risk. So. Little tangent there, but
now we're going to talk about Bitcoin.
But now let's kind of dive into what we're going to speak about is returning to the gym after our injuries. So, what do we do? Do we keep training, Zach? Is that what we just should do? Should we just rub dirt on it and just be like, you know what, I'm going to keep going?
So, yes and no. This is the most non-answer ever. You want to make sure that
It depends.
It does, yes. I shouldn't have shaved. So you want to make sure that you stay as fit and active as you possibly can after any type of initial injury. A lot of times I tell this with people with back pain, and the research is pretty supportive of this. The worst thing you can do is nothing. So if you sprained your hand or something, and your first thought is, okay, I hurt myself, I'm just going to sit on the couch and chill and veg out and catch up on Queen's Gambit.
Oh
yeah, here's a good show evidently.
Wife loves it.
Does she?
She loved it. She watched it all already.
Did she hurt her hand?
No.
Yeah. That's not necessarily conducive to an ideal healing environment. Well, in the early stages of an injury, you may need to rest a specific area. Like if you sprained your ankle, you don't want to go for a hike and walk on it, especially if it's swollen. But it would behoove you to still move as much as you can in a manner that doesn't that isn't counterproductive to that healing process. So if you're moving so much that it's hurting really bad, swelling increases, that's probably too much. But if we can find ways to continue moving that don't aggravate the area that's effective, that's a big win.
Yeah, and I think to expand upon that is, if you are moving or you're continuing to move, say we go back to the ankle patient. If you're doing bicep curls and you're exerting yourself pretty high, your heart's still pumping blood everywhere. It's happening to your entire body. It's not that this. I mean, yeah, you're probably working on some sweet biceps, but at the same time, your body is delivering nutrients to everywhere. It's circulating everything, and I think that's one of the biggest benefits of staying moving, is that you're still getting circulation. You're still getting nutrients from your blood, delivering to all these places, even though you're not necessarily working that area. We can't work something in complete isolation. It doesn't really happen. You still get full body effects.
Absolutely, and if you keep on going with that, it minimizes the potentially a risk of having problems when you go back into the gym. But also too, it helps keep your conditioning levels up, so then when you do inevitably get back to training the area that you hurt, you're not just roasted and destroyed.
Yeah, ground zero.
Because you've stayed in shape that whole time.
Yeah. Yep, that's good. So you had some cases that you wanted to potentially speak about.
Yeah, so this is, I don't know what it is, but it feels like in the last couple weeks we've had a couple individuals who had a situation outside the gym where they did something and their back started hurting.
Yep.
And as I mentioned before, the research is pretty clear that delaying movement when it comes to back pain increases the duration that you're going to have back pain. So we want to do everything that we possibly can to ensure that our wonderful clients here at Elevate Sports Performance and Healthcare stay moving and grooving so they can bounce back quickly. So what we did for these people was they came in to see me. We went through a full evaluation. We did some stuff so they could get a little bit more comfortable back-wise. And then what I did was we went out into the gym and we just kind of tested the waters to see what movements they could and could not do in the gym. And we found several different activities. It's just like you were talking about, Dr. Booth. You can still work on the gun show. You can still do some pushing and pulling. There's still some leg stuff that these people could do. And we designed a program that they could perform while this area is healing up and they're bouncing back to normal. That allows them to still get a training effect. One, two, but then it also works on areas that could also benefit their back motion and their pain. And I think it's really important that you continue to do that regardless of where you've hurt. And even when I was in the NBA, if we had a guy who had some type of foot injury where they had to wear a cast or they had to wear a walking boot, well, they didn't have a walking boot on their opposite leg, and they certainly didn't have walking boots on their arms. So they would come in, train, well up until even their surgery sometimes, and then we would, as soon as they recovered from kind of the initial surgical things that happened, we got them back to training.
Yeah, we had another case. Guy played. He's getting into golf. I'll repeat that. He's getting into golf, and he was playing a couple times a week. Pretty consistent for a couple of months, and then all of a sudden, 7 days a week, 2 rounds of golf on some days. Just like an insane amount of swings in the course of 7 days. And he comes in, he's like, I hurt myself. And I'm like, what happened over the last week? He's like, I played 7 days, sometimes twice in a day. It's like, okay, well, yeah, that's definitely a big injury. This isn't necessarily returning to the gym, but maybe returning to training. We took the same approach. We wrote an entire program where we weren't necessarily stressing the back. We got him onto a custom training program where he could complete stuff that, he was still getting a massive pump. He was still getting a good sweat. We just weren't putting him into the provoking positions that he couldn't do. For him, it was anytime that he leaned forward or bent forward, he was having pretty gnarly back pain. So we can program around that. We have pretty smart people here to program around that. And we created multiple days with different stresses, but not stresses onto that area. And now we're 2.5, 3 weeks later, and he's going to be going in for a swing evaluation so that it doesn't happen. Hopefully,
awesome.
hopefully later on. So we're going to look at the efficiencies of his swing and see if that's if we can tweak a couple of things in his swing. But it just goes back to the you still have to stay moving. If he would have been a couch potato those 2.5 weeks, he does have like really significant MRI findings, and that stagnant kind of mentality would have made that stuff probably exacerbate even more, or stick around for a longer period of time and make it more sensitive. So I think that was a really good case where we see see what we can do for movement over these couple of weeks while the tissue heals, but make everything else try to heal indirectly than with the tissue being sensitive.
Yeah, and then also too with that you have less of a likelihood of having a flare-up of symptoms when they do go back into activity, just because their body is prepped to do something that is a bit more.
You like the conditioning said, like
Exactly.
they're not just, dogging it after 2 minutes of work. They're able to sustain a little bit of endurance there. I think, and I don't know what you've seen with like being in the NBA and some of the people that you've worked with, but most of the time when people get extremely fatigued, we start seeing kind of funky, sloppy movements.
Absolutely.
And if that happens at a very quick rate, if you hit a red line at 5 minutes into your workout, the rest of your workout probably is not going to be as coordinated, or your strategy is not going to be as good as it probably could be. So again, those are definitely wins for us when we see the whole model work very well, when we get to work with a medical provider and the medical provider can facilitate a good coaching program, get them through those acute bouts of pain, and then after they get through that, this is a cherry on top that we work with a lot of golfers and a lot of like swing evaluation and stuff like that. Now we get to figure out maybe a little bit more of the root cause of this swing that might have been irritating. And it doesn't help that he probably swung the ball or swung the club.
I'm gonna look up swang because I kind of like that.
I like
kind of like swag.
It doesn't help that he had probably 1,000 swings in a week. So again, those are our wins for some cases. Just to kind of hit home the fact that we need to stay moving, or we need to have a strategy for staying moving. And then there's another strategy, visualization. The power of the mind is very, very important. It can get us through a lot of things. It can also go the opposite way. If we let the mind win, then it can kind of tell you what you can't do. So you have to make sure that you visualize and your imagery is on par, right?
Yeah. Well, and there's some really cool studies where, I think it was with the wrist, from what I recall.
I remember hand stuff,
Yeah, where they basically had people do resisted exercise. They had a group do nothing, and then they had a group just visualize doing the resisted exercise. And there was still a significant strength gain with those who visualized the movement compared to those who did nothing. So if you sprain your ankle, it's always the ankle sprain.
Yeah.
Or even better, let's say you had a knee surgery and you're non-weight bearing, you're not allowed to do anything. You can still visualize doing exercises on the side that's effective and still get a training effect, which is really cool. We had someone who I'm working with who had an ACL repair, and in the beginning phases of rehab, I had her doing single leg squats on the side that wasn't surgically involved, but then I had her visualize doing those single leg squats on the surgical side. And anecdotally, my bias, and obviously I can't cross-reference this with someone else, but having introduced movements that are like the single leg squat have gone way easier for her, and she's been able to maintain really good strength levels. And I have a feeling that was a contributing factor. Moreover, if you train the side that wasn't injured, you do get some crosstalk to the side that was injured that can also improve your strength. So there's lots of ways that you can continue to maintain a training effect in the area that's hurt. And visualization plays a huge role.
Yeah. The mirror box stuff too, right?
Yeah, yep, I've done that stuff too. It's great.
Yeah, so mirror box, so you put your hand into something and it shows what it could potentially look like on the other side if it was able to move at the same coordination as the non-injured side, but that is a really good stimulus for imagery and visualization too. So if you kind of see like where your hand would be placed, that would definitely help stir that thought process of, oh, I can do this, or I am doing this.
Yeah, absolutely, and that's been a thing that's used a lot in people who've had amputations.
Absolutely.
It's fairly well researched, actually.
Yeah.
It's been pretty useful.
Yeah.
I've used it on quite a few patients.
So those are our keep training tips. So we definitely need to keep training different areas. We've had some wins with different programming in our model that we've worked, and then also the visual and the imagery aspects. So those are all ways to keep yourself training during an injury. And then we need to once we do start getting back into maybe potentially the movements that are provoking for these tissues that are injured, we need to have a strategy for that. So we intro to the working area slow, and then on the other side of the spectrum fast. What's that look like most of the time for a patient?
Yeah, so what you're basically trying to do is start with low loading based activities. And what I mean by that is, like, think of load as, we go back to the bicep curls, because Dr. Booth and I, can never get enough of the bicep curls.
It's just so easy to do.
It is. Lighter weights are obviously easier than heavy weights. And what's even easier than moving a weight would be just holding the weight in your hand and trying to maintain position. It's called an isometric. So a lot of times we start people with those types of activities in the beginning of their training. What this might look like is, let's say you hurt your knee and you want to get back to squatting, because squatting is a wonderful exercise. We have a lot of people squat here. You might do a hold at a range that's comfortable for you. So you might maybe hold your kettlebell or dumbbell or something like that, squat down maybe a quarter or halfway, hold that position and proceed to suffer in the nicest way possible, because your quads will be on fire. And you might do that for a set period of time. Once that goes well, then you might move to going towards the full, slow, fast motion with lighter loads, or the up and down motion, I should say, in that same squat. And then once that's good, you might go to lifting heavier weights, and then you might go to doing squats either with speed or anything like that. And this is generally our progression. So it's not move slow, move heavy, move fast.
Yeah, I like it. I think the tempo, the second one is where we can potentially lose the patient sometimes. We have to be very good at describing what to do and the tempo to have, and then anytime that you started to say, a knee patient potentially, getting into a squat, obviously with like a patellar tendonitis or something that's irritating into the front portion of the knee, that is huge to explain what a tempo work looks like. So when we were talking about isometrics, the next one up, he was talking about tempo work, so being able to stay the same pace the entire way through the range of motion, not having that bounce effect, or like when you change direction, it goes kind of quick. So getting down to the bottom of squat, a lot of people will kind of like almost bounce out of the bottom and then come back up and use that momentum to get themselves out of the hole. That changes the acceleration downward. So if we're going into a squat and we're dropping our hips, and then it all of a sudden drops pretty quickly and kind of bounces back up, most of the time those tissues are not happy doing that, and that's actually what causes some of those things to get sensitive. So make sure that that transition from going from an ISO to our tempo work, you get really good explanation on what that means, and there's a good understanding of keeping that pace the entire time.
Yeah, absolutely. Especially if you had any type of tendon issue.
Yeah. Tendons don't like being stretched very fast.
No.
When they're ticked off.
No, they do not. Another thing to consider too. Now we've talked about don't move very slow, move heavy weights, move fast. You can still incorporate things. So if you're doing like the hold positions that we talked about with the squat, does that mean that you cannot jump until you've gone through this progression? And the answer is no. You can still work on things that are later on in the progression. You just have to choose easier variations. So when we did a doc talk a few weeks ago,
The jumping?
it's been a blur. Yeah, we did a jumping one that will be on the website at some point. I'm getting close. I'm getting close. I'm knocked out most of them, actually. But we have a variation that we like where you're sitting and then you jump up to a box while you're sitting. That's a very low stress jump progression that you could utilize at the same time that you're doing some of the squat holds or even some of the tempo work. Mm-hmm. So you can incorporate a lot of different variations within the spectrum. You just have to make sure that the moves that you're choosing are pain-free and they're not too stressful to the area and they don't leave you swollen or sore, wherever it is that you've hurt.
Yeah. Yeah, so just less technical, right? Less things to think about, less mistakes to potentially have if you're getting into some of those higher accelerating moves.
More constraints.
Yeah.
Yeah. You can lift heavy if you're using a leg press. Maybe you're doing the slow squats, but then you throw a leg press in the mix because you want to lift heavy because it's a more controlled environment for you to move some weight around.
Yeah.
And there's nothing wrong with that.
There's no stability components. It's literally move the slide.
Mm-hmm.
So.
And torch the quads.
While doing bicep curls.
Of course. Yeah.
I think that's pretty important.
We might have to video that so people can.
We don't have a leg press here. Maybe we'll get that soon.
Mm-hmm.
All right. So then when we finally have made it through the spectrum, we're getting close to starting to make decisions on what's next, or how do we keep on getting better or progressing. What are the key things that the patients need to work on as they get out of that phase and into the next progression phase?
The hashtag major keys
Hashtags.
is, as you're progressing through this, you need minimal pain with each specific move. So it's not uncommon if you haven't worked an area for an extended period of time that when you go work that area, you may actually have a slight increase in pain. Could be after the fact, could be slightly during. That's normal and that's expected. Pain is there to protect you, and it protects you against things that are different than what your normal is, homeostasis. So like for example, if Dr. Booth here is chilling like Bob Dylan, bicep is in its normal, incredibly ripped state, if he does something that strains the bicep,
it's impossible.
It's very strong. He goes from curling 75, which is his normal warm-up set, to the 100s, and all of a sudden his bicep starts to hurt. Well, if he sustained an injury there, it would be normal to experience pain because something is different about the natural bicep state that Dr. Booth has. Now, after he goes through the healing process, and Dr. Booth reintroduces curls, well, that's kind of going back to the environment that was the initial injury thing. So from a protection standpoint, I think it kind of makes sense that your body would be a little bit skittish about getting into that. It's just like I always tell this to my clients. If you say, heaven forbid, you got mugged down a dark alley, and you walk by a dark alley several years later, you actually might get a physical response to being in that dark alley. So your heart rate might get up, you might be a little bit more vigilant, you might sweat. That's all normal because your body's very smart about making sure you don't make the same mistake twice. Mm-hmm. Same thing when it comes to going back to activities that hurt. So just work through that process. If you get something that gets you a large flare-up or you get an increase in swelling or anything like that, then you probably went a little too far. But don't be afraid to have a little bit of discomfort when you're going back to these things, or even have a day where maybe you're sore for 24 hours. That's totally normal.
Yeah. That has to be echoed. You guys, there's so many people that will, it still hurts when I squat. And it's like, well, they haven't squat since their injury. Of course there's gonna be a little bit of discomfort there. If it's if it's not as high and there's not like that acute bout of like, oh my gosh, now it just like wrenched my back and it went out, or whatever other term you want to use for that. If it's discomfort and it feels like a little bit tight, or it feels tender to kind of move those things, use a scale. I personally give people scales as much as I can, because it gives them a sense of comfort that they know where they can work at. We use a 1 to 10 scale. If it's on the low ends, the 3s, sometimes a 4, go for it. See if you can kind of work through some of those, because I think a 3 and a 4, if they know how to scale themselves correctly, that they'll probably have success within 24 hours and getting back down to a baseline. So then you have a successful training bout. You stress the tissues. Now they're going to be able to adapt from that. They're going to get stronger. They're going to build collagen, and they're going to do all these types of things that the body does when it adapts. But if we don't have those stresses, then we're not going to have adaptations. We're just going to kind of keep on going with the process that you're currently doing if you're not moving those things.
Yeah, absolutely agree with you 100%. I always tell people, if House is a Pain, not to be confused with The House of Pain by Tyler Perry, but you want to knock on the door, you don't want to bust it down, but you also don't want to play on the lawn.
Yeah.
So,
I mean, busting the door down and playing on the lawn, you're gonna still be in pain. Like, there's still gonna be pain there if you don't introduce yourself.
Yeah.
Right? Maybe a handshake a little bit.
I like.
Yeah. Introduce yourself.
Man, you just took it to the next level, my man. I love it.
Another thing during progressing is it's a really, really good time to challenge your thought process or your strategy on technique and movements. So during the time that you're reintroducing the movement, if you think you are a technique, you're flawless at doing a squat or flawless at doing the curl, take a step back, humble yourself for a second, and see if there's any way that you can possibly do that better, and see if there's any flaws in your approach and your strategy that you can work on at a slower pace, a lower weight, and just start owning those foundational movements. We actually just had a patient, he just left earlier. He got hurt doing back squats, and he was just telling me what he was doing at his CrossFit box. His coaches really regressed him back down to like a foundations course, or like a really like minimal movement, very slow renditions of squats, and really trying to hone in on stuff. And he's like, yeah, I'm doing like 50% of the weight that I used to do, but I'm completely concentrated on changing my strategy and my technique. So he's doing it right. He's 50 years old, and he's someone that just has an insane motor. He wants to train a lot, and his body's telling him what he can and can't do at this point. And now he's kind of retraining that so he can make his potential still pretty high. Yeah,
and especially if you're someone who maybe you're hurting during the move on your return back. A lot of times if you refine your technique or you work on those little slight improvements, that can actually help on the pain side of things, because you're getting a better loading throughout your body. It might not be as stressful to the area that was in question. So do sweat the technique. It's important.
And then let's talk about our normals.
Yeah, and then the last thing too is you want to make sure that you get your strength power levels up to around the level that you were at before you started getting into training. So for example, if you're used to, so Dr. Booth, actually, thank you. He's doing his 75 pound bicep curls, right? If he only gets to the point where he's at 50 and he can't do the 75s, Dr. Booth might not be ready for the next progression from that, which, I don't know what your
bicep progression.
Maybe your one arm chin up.
Yeah. There you go. So weighted chin ups, yeah.
Yes. So which I'm sure that's probably your warm up to the bicep curls is you do a pinky one arm chin up with chains hanging down. So we want to make sure that your strength levels get up enough to where they're as close to normal as possible, or even sometimes beyond that before you go to the next phase, because that's another indicator that you might not be ready to really challenge yourself.
And whether that's tissue or confidence.
Yeah, absolutely.
Tissue healing or confidence, it could be either one of those.
Yeah, I go through this a lot when I'm rehabbing people after knee surgery. We have in physical therapy we have like a hop testing that you would do, and there's 4 different tests. One would be like hop as far as you can on one leg. Zoe's going to be sweating when she hears this. A triple hop where you do 3 hops in a row, a crossover hop, and then doing it for 9 meters in terms of speed. And ideally, you want to be not only symmetrical to the other side, which that's actually not really the best indicator because there's reduction of force on that side, but you also want to try to do it at levels that you were capable of doing well before that. Because a lot of times people can have good motion, they can feel good, no pain, but if you don't have that strength back to where you need to go, it could potentially increase your risk of developing some type of re-injury or running into pain again.
This is probably not the easiest question to answer, but if someone didn't have a baseline measurement, what would you go with? Like how does that
Yeah, that's a really good question, because that was the problem I ran into. So we would look at their performance of activities that they may have done prior. So maybe if I think using the gym stuff as an indicator is a good way of looking at it, but maybe it could be their sport and testing out specific moves that would stress the involved area. So if you play tennis and you had a really hard time doing a stop, hit the ball, and then go to the other side, maybe that's something that we could look at, and then just compare side to side to see if you can do it as fast as the other side, or playing against your competition that you normally play against. Are they smoking you? Well, then maybe that's an indicator that you're just not ready, and then we could just titrate or do a small amount of that particular stimulus before we take you to the next level.
Isn't there like a test where you'd run around a circle right or left to test like knee ligaments potentially?
I'd have to look into that.
I
don't know.
For right and left bias, or maybe it's an L test or something like that.
Or there's a 5-10-5.
Yeah, I'm just thinking that, like,
I'd have to look at
there's
that.
one that if you're running in a circle, you're stressing, the outside knee potentially more. But anyways,
but now that you mention that, what you could look at is, and I'm thinking of grip strength.
Yeah.
Well, if you have a test that compares you against people your age, that's actually probably a good indicator to see if you are in a good spot. They don't have that for the hop test that I was talking about. I'm glad you said something. But like vertical jumps, there's normative values for your age of what you should be able to, what the average person your age could vertical jump. And so if you can't do that, you're probably not as ready as you could be. Grip strength's a good indicator. So if you injured your shoulder and stuff like that, it's not uncommon to lose grip strength in an affected area. So you could test your grip strength and compare it to people your age and see if, am I up to where I need to be?
Cool. Well, guys, so we have our tips. We talked about how to keep training. We talked about the introduction of the provoking movement, how to go stepwise. Go no movement, very kind of controlled movement, increase the weight, and then finally go fast. Want to go fast. And then figuring out how to progress or when the right timing is to progress. So those are our tips for getting back into a gym setting, a training setting, a sport setting after an injury.
And if there's the biggest takeaway you could probably get from this is always do bicep curls.
Always do the steps.
Yeah.
And then the second biggest takeaway is
if you are one of these peeps who has gotten hurt and you still want to train, but you need a little bit of help problem solving through that because maybe you've tried going back to the gym and it's just not cutting it. These fine doctors here can help you. Give us a call at 702-558-2151. Elevate Sports Performance and Healthcare. We have locations on Sunset Avenue in Las Vegas, or Sunset Road in Las Vegas, and then Eastern Avenue.
Yep. Eastern
in
Sunset.
in Henderson. So please give us a call if you need some help. You can talk to either of us for free with one of our discovery sessions, and we would gladly help you troubleshoot whatever it is that you're struggling with.
Cool. Give us a shout out if you guys need anything. Let us know. Thanks, guys.
Take it easy.